I trained in both rural and urban environments. So I trained in West Texas for medical school and did all my postgraduate training here in the Dallas area. My first exposure really to rural medicine was in medical school, and came back to Dallas, worked for 10 years in a large academic institution. And while I was doing that, began working in rural East Texas. And it reminded me of the time that I had in medical school with rural West Texas patients, and really, I think, rekindled my interest in rural medicine, and really kind of opened my eyes now, having practiced for 10 years, to seeing the opportunities to improve the level of care in rural America. I found myself in rural East Texas as a general hospitalist, taking care of whatever came in the door, and really found it to be an incredibly fulfilling type of work. And so began working more deeply in rural medicine. And as I did, began to see opportunities in working in partnership with the hospitals, that there were a lot of things that could be done and patients that could be cared for in these hospitals, but they lacked the depth in their medical staff. So we began to work with the hospitals to try to figure out how can we build programs that use all the tools you have here, but permit the hospital to actually retain those patients who they're putting on helicopters or putting in ambulances. Naturally, telemedicine was something that needed to be explored as a way to address that problem. So that was really kind of the genesis of it, and led to our first program in East Texas in 2013.